Hello, I'm Dr. Maya Chakerian of Sereno Sante. Today I will be discussing the use of low-intensity extracorporeal shockwave therapy for the treatment of female orgasmic disorder and chronic painful sex. Recent surveys of men and women regarding their sexual enjoyment has shown that 70% of women do not orgasm during sex and that 60% of women are dissatisfied with their sex lives. Female orgasmic disorder, or FOD, refers to difficulty reaching orgasm, either not reaching orgasm at all or taking longer to achieve orgasm. FOD is generally persistent and may interfere with relationships and lead to the woman feeling significant distress. It is estimated to affect up to 28% of women in the US and Europe, making it one of the most common sexual disorders in women. Let's discuss anatomy, since the female genitalia can be confusing to some. Although the clitoris appears small from the outside, there is about 5 inches of additional erectile tissue inside the woman's body, located deep to the labia. Although not seen, this erectile tissue plays a part in the overall sexual experience in women. Women of all ages can be affected by FOD. There are many factors which can be involved, including behavioral factors, which may involve nutrition, obesity, and the use of alcohol and tobacco. Psychological factors such as stress, anxiety, depression, and low self-esteem. And biological factors such as hormonal problems, reduced blood flow, and disability that may come with age. With menopause and certain medical conditions, the erectile tissues become smaller or less reactive, which can decrease sexual desire and responsiveness. We have a new tool called the Orgasmic Function Scale, which scores orgasm quality from 0 to 4. The question is, how would you rate your ease of orgasm with a partner? A score of 4 indicates that the woman can achieve orgasm within 5 to 10 minutes and may be able to achieve multiple orgasms. A score of 3 indicates that orgasm is possible but takes more than 15 minutes. A score of 2 means that orgasm is achieved only with the use of a device. A score of 1 means that orgasm is able to be achieved 20% of the time, and a score of 0 means that orgasm is not able to be achieved. Applying non-painful shockwave therapy, as we do with Jillwave, can bring the erectile tissue back to a younger, more responsive state by improving blood flow. This results in more sexual satisfaction, and by doing so can improve sexual relationships. Jillwave is performed by applying pulses of shockwaves to the clitoris and the outer labia. The treatment takes 15 minutes, is non-painful, and is free of side effects. It involves no medication and does not require anesthesia. The treatments are repeated twice a week for 3 weeks. The Orgasmic Function Scale assessment is performed again after the treatment series is complete. If after 6 treatments the woman has not reached a satisfactory response, we recommend repeating the series of treatments. Although Jillwave has only been approved for treatment of women for the past few months, clinical studies have shown improvement in lubrication, quickness to orgasm, and improved sensation. The average improvement in the orgasmic function score is at least 1 point after the series of 6 treatments. There was another recent study performed using low-intensity shockwave therapy in women who experience painful intercourse, which is a condition that can be exhausting and interfere with the quality of sexual life and impair relationships. This therapy was found to be effective in improving discomfort with sex and in overall sexual satisfaction. The treatment was not painful for these women. It has been proposed that shockwave therapy reduces inflammation in the genital region by promoting the release of growth factors and anti-inflammatory factors, and by improving blood flow. Therefore, Jillwave may be able to help the many women who suffer from painful sex be able to have more fulfilling sexual relationships. Many of you may wonder if there is a medication which can help women's sex lives. There are some medications which are indicated for the treatment of low sexual desire in premenopausal women. 2 brand names are Addy and Vyleesi. These medications' use is limited to treatment of low sexual desire, while Jillwave is indicated to help improve sexual pleasure and stimulation. These medications are not indicated for postmenopausal women, and they are not designed to help with orgasms. There are a number of side effects and contraindications with these medications. Addy cannot be used in combination with alcohol and certain other medications, including oral contraceptives. Vyleesi cannot be used by women who have uncontrolled hypertension or heart disease. Jillwave can be used to treat any adult woman, regardless of menopausal status, and there is no interaction with any substance or medication. The perfect candidate for Jillwave is any woman who has lost sexual drive or has pain with sex, or who has difficulty climaxing. In some cases, it is recommended that couples undergo treatments together for optimal sexual functioning. I hope that this information has been of value to those women and couples affected by female orgasmic disorder or female painful sex syndrome. I am Dr. Maya Chakerian. See you soon at Sereno Sante.